Hello to all of my future nurses and current nurses, new nurses out there. In this video, I'm going to review how to change a central venous access device dressing. Now, you may know that this is a central line dressing, and so that it is extremely important that it is a sterile procedure. I'm going to be changing the dressing of a triple lumen, but this is also the way you would change it if you had a PICC line. So this is a PICC line. If you imagine that this is my arm, okay, this is a PICC line, and so I would change it exactly the way that I'm going to change my triple lumen dressing catheter. Okay, stick around. So the first thing we always do is perform hand hygiene. So I'm going to perform my hand hygiene. I'm going to identify my patient and make sure I have the right patient. I'm going to explain the procedure to my patient, explain that I'm changing the central line dressing because it's been 7 days and we want to prevent infection, so we want to make sure that it is clean and not compromised. The next thing that I'm going to want to do is adjust the bed and create my workstation. Now, in most cases, you're going to have an overbed table, so it would be totally appropriate to have your overbed table on an angle on your side of your dominant hand where you're going to be working. Unfortunately, today I don't have an overbed table to work from. So let's say that I'm using my patient's bed. Okay, now this patient is in a 90-degree angle, but your patient could be in a 45-degree angle. The patient could be supine. Whatever is comfortable for the patient is totally fine. You should be standing on the same side as the dressing, as the central line. So the next thing that I'm going to do is go ahead and open my kit. And inside right away I see a surgical mask, and that is for me to wear so that I'm not breathing or coughing or sneezing over the central line. So I'm going to put my mask on. Now, the next thing I see are sterile gloves, but remember that before I put on my sterile gloves, I want to go ahead and put my protective disc inside. Really important, because the protective disc, the outside is not sterile. So if I put on my sterile gloves and then try to put this in, I've just broken sterility. So I'm going to go ahead and do that now, opening it to the side. And then I'm going to drop it in to my kit 6 inches above my kit. Okay, so now we have our tray open. We have added our protective disc into our sterile kit, but we do not want to put our sterile gloves on yet because we still have to remove our transparent dressing. Remember that we are going to just use regular clean gloves to remove this dressing, because if I were to put on sterile gloves and touch the outside, which is not sterile, I would be contaminating my gloves. So I'm going to go ahead and perform my hand hygiene again. And I'm going to put on some regular clean gloves. The most important thing that I used to get really anxious about is making sure that you don't accidentally pull this, the central line out. Now, it is usually sutured. Mine is not here, but it is usually sutured. The best way that I have found to do that is I usually bring some alcohol swabs with me, and I will just kind of moisten the edges of the transparent dressing to kind of help loosen the dressing. And then you want to maintain at least one finger on the line itself to prevent it from being dislodged, obviously above the transparent dressing. So with one hand, I'm going to go ahead and start pulling away. And now I'm going to be doing it a little bit more aggressively than I would be doing it on a real patient. You know, whenever you're taking tape off of a patient or a transparent dressing, you want to pull the skin away from the dressing rather than the dressing away from the skin, because obviously you do not want to hurt the patient and cause any skin tears or things like that. In this case, this is a plastic mannequin, and the dressing really likes to stick to the plastic. So I'm a little bit rougher, but you would do this a little bit more gently with a real patient. So remember, you see that at all times I have made sure that I was on top of the dressing, holding the line in place. I'm going to continue to do that all the way until I get this dressing off. Now over here I can touch, so I'm going to go ahead and put my finger there. And I was so lucky the biodisc actually came off with the dressing. So I'm going to go ahead and throw this out. I'm going to take off my clean gloves. I'm going to perform hand hygiene, and I'm going to go ahead and put on my sterile gloves. And I'm going to grab my sterile gloves. Now my sterile gloves did open in here, but most times it's folded, so you want to just grab that corner. And I'm just going to move my kit a little bit out of the way. Now it is okay to use the patient's bed as a sterile, a workstation for your sterile field. But you have to really think about the kind of patient you're working with. If it's a patient who's not going to be compliant and will be moving around, then obviously that's not ideal. So you want to use the overbed table. Okay, so remember that the inside of this wrapper is sterile, so I'm going to go ahead and just drop that to the side. And I kind of like to use that as my garbage. And I'm going to go ahead and grab my tray from the inside, because inside is sterile. All right, what I'm going to do now is move the camera so that you can actually see what I'm doing. So unfortunately, I haven't been able to make it so that you can see both at the same time. But I think it's more important for you to see what I'm doing up here than for you to see me grabbing things from the tray. So now that I have my sterile gloves, I can touch every single thing that's inside the kit, but I want to make sure that I don't touch anything that's non-sterile. Okay? Now, before I put on my sterile gloves, if I had any kind of stabilization device, that would have been the appropriate time to remove it and replace it as per facility policy. Okay? But in this case, I did not. The next thing I'm going to do is grab my alcohol swab stick and just tear this open. I'm going to take out my swab stick and I'm going to use it to clean any old blood or drainage. Okay, so in a circular motion, I'm going to wipe off any old drainage. So what you want to do is start at the insertion site. Obviously that's the cleanest area, and in a circular motion go outward. Never go back in. Once I've gone out, I don't want to go back in. The next thing I have is my ChloraPrep, and what I would do is squeeze this, and you're going to hear a snapping sound, and I'm going to go ahead and shake it, and that activates it so that the ChloraPrep will go into the sponge. And I'm going to apply this chlorhexidine using a gentle back and forth motion for at least 30 seconds and then allow it to dry. So I'm going to obviously start at the insertion site, and I want to go ahead for 30 seconds and clean the insertion site as well as the tubing that I see that's out, and obviously it's cleaning all the surrounding area. So we did that for 30 seconds, and then I can go ahead and clean any outer area, but just remember, once I go to the outside, I'm not going to go back in towards the insertion point. Now it's extremely important that you allow this to dry, because that's how you're actually killing any bacteria that might be in the area. So I'm going to allow it to dry. And the next thing, now if I saw that my patient was still bleeding, I would want to put a gauze dressing on, and that's to help absorb my drainage. Okay, however, that is only good for 48 hours, so I can go ahead and put this around the tubing, and I can put this gauze 4x4 on top of it and cover it with my transparent dressing. But that would only be good for 48 hours, because that drainage collecting on here is also a source of bacteria that can happen. Okay, so the next thing I want to do is go ahead and grab my biodisc. The biodisc has this little hole in the center to go around the tubing, and this slit, and this has an antimicrobial solution in it to help keep it clean. It's another barrier to help protect your central line. So I don't want to touch it, even though my gloves are technically sterile. I want to try to eliminate or prevent touching my triple lumen as much as I can. So I'm just going to go ahead and put this on here by holding the tip and then just making sure that it's actually on. Okay, so it's on. And the next thing I'm going to do is grab my transparent dressing. This is a semi-permeable transparent dressing. And now this one is a little different than the one that I'm usually used to. We usually have one with just a white border, but it's pretty much the same idea. I'm going to take this first tab off and then remove this blue tab. You could actually put it on the patient first, keeping in mind that I want to obviously keep this area protected, but then at least 1 or 2 inches surrounding it. So making sure that I consider that when I put my dressing on. So I'm going to go ahead and take this blue tab off. Now again, if you have the one with the white border, then you would just basically take the white border off. And here in this case I have these 2 sleeves that need to come off, so I'm going to just take them off. Now my dressing is protected. Excuse me, my central line is protected, so I don't have to worry about sterility. I can touch. And usually there's also a roll of tape in here. And so what you would do with the roll of tape is pretty much secure the perimeter of the dressing. So there's usually a roll of sterile tape that's in your kit, and you would just basically put one piece on each side. So I can just show you that really quickly. And that's just another way of hopefully preventing the central line from coming off. Okay, so I'm going to put this here, and then I would just put it another one here, another one there, basically forming that box. And lastly, what I need to do is date and time. Okay, so then on a piece of tape, or again if you were using the one with the white border, it comes with a little labeler. I also have, I believe, a labeler in this kit, so I can just go ahead and write the date and time and put it on here. And that's really important, because now the next nurse that comes in can see, oh, the dressing was just changed today. It's good for another 7 days as long as it's clean. Okay, so that's how you change a central venous access device dressing. Be sure to write any questions or comments in the comment box. And if you have any comments about something new that you've seen, I'm always open to learning from you as well. So the channel is open for open feedback and communication. I'm really excited about the fact that you all have been commenting and, you know, just shedding some light on things that you've also seen. So let's continue to do that and support each other, because that is the greatest thing about nursing, is that every single day we learn something new. So I look forward to learning from you all as well. If you haven't done so already, make sure you subscribe to my channel so you can see more videos. And I look forward to speaking with you soon. Bye-bye.